Welcome back to my Mental Health and Crime channel. My name is Huda London. Please like, share, and subscribe. I'm a licensed cognitive behavior therapist and a mental health counselor. Today, I would like to go back to discuss the case of Beatrice Bijot. Beatrice is a 31-year-old woman from Florida that basically drove into four people with the SUV on the 2nd of February. She fled the scene, or she was on her way to the police station, according to different reports. When the police stopped her, she said, "I heard voices telling me to kill those people who were standing and shopping in front of a grocery shop." She said the voices were telling me to kill them and to kill myself. Last week, Beatrice was put on the court as a person who does not have any... I really don't understand. Allegedly, she's been put and booked on a full trial. So I'm sure psychiatrists have done evaluations with her. This is a real strange case because we don't know if Beatrice is abusing the Mental Health Act, or if she knows what she's done intentionally and she's trying to use and get sympathy for the Mental Health Act, or we don't know if she does have bipolar and schizophrenia like she is saying. Because when we heard her boyfriend's interview, some things did clearly not make sense. He said that he was aware that she was using medications for bipolar, but she was saying she should not take those medications on the weekend when she was at her boyfriend's house. So it looked like Beatrice was saying that she was hiding her bipolar syndromes and her schizophrenia disorder. She said that they were trying to have a child, so I assume that's the reason she didn't want the medication to affect her pregnancy. If Beatrice Bijot is really a mental health patient, I really wish she gets the help she needs, because she clearly needs her medications. Schizophrenia is a serious mental health illness that really needs monitoring. If she's telling the truth, then you can imagine, with everything that was going on, I believe the first place that they should have sought was calling a psychiatrist immediately. I don't think she would have just come out with the psychiatrist's full name, his work location. She said the last time she saw him was in 2019. And it wasn't even a psychologist. It's a psychiatrist, she said, that diagnosed her. She believes he was originally from Nigeria. So those were Beatrice's words. So I don't think, unless she's a lawyer and she knows all the laws and she's trying to twist it, something doesn't make sense here. But the good thing is they will get, the courts and the defense, the district attorney will definitely get the most knowledgeable psychiatrists in their areas to look at this case, and it usually isn't one psychiatrist evaluation. I'm sure Beatrice's attorney will get his own psychiatrist through to just double check the evaluation. This is really confusing, but then sorry to say, I still do believe, thinking about it, that Beatrice could have schizophrenia and bipolar, because actually it is the fact that she has it, because when the officer, if you watch the last bit of the interview, when she's giving her statements to the officers. They clearly asked her, they came out with a long list and they were talking about the places that Beatrice Bishop has been put in, psychiatrist institutions. And she explained to him for what situations. She was remembering some of them, like once she was wandering off, I believe with very little clothes or something, and she was saying about different situations, and she said she was put in a psychiatrist institution thrice in Florida. She said she was put twice in Texas, and there was another place, I think it was Houston, she mentions. So on the whole, there were 6 times she was put on in a psychiatrist ward. Then that brings us to the question, if she has been put in institutions before, how come the mental health system wasn't, I wouldn't say wasn't aware, but why didn't the psychiatrist double check and call her for a new appointment just to make sure that she's taking her medication? And then we have her boyfriend, who actually gave us a bit more ideas. He said she's a very intelligent and smart woman, but he said she never gets sleep at all. He said that she could go days and days without eating and sleeping. And I find that very interesting because that is typical signs of bipolar. I find it interesting because if she was going non-stop without sleeping and without eating and just being awake and overworking, if this was going on exactly for 7 days or a bit more, it would be bipolar 2. And if it was for 4 days, it would have been, no, sorry. If it was 7 days or more, then it's bipolar 1. And if she was having a 4-day episode and then she went to a low mood, it could be bipolar 2. But the medications she was talking about and the medications her boyfriend mentioned, they do belong to bipolar. So if she was, like her boyfriend said, not sleeping and not focusing, then obviously if she's suffering of bipolar and schizophrenia, like she said, the hallucination part will come in of the schizophrenia. She'll start hearing voices, which is very dangerous. And just the fact that she was saying she has suicidal thoughts, she must have said that 4 times in this interview. So if she was not lying, then that is serious. They should have put her in a psychiatrist ward immediately. They should have got a psychiatrist, an emergency psychiatrist, or someone from the mental health team, especially a psychiatrist is needed to evaluate her and to check her medical history. So I hope justice is served for the victims, the poor victims who got run over for no reason. And if this woman has mental health illnesses like schizophrenia, which is a severe mental health illness, and bipolar, then I really hope she gets the mental help and physical help she deserves, because she wouldn't even know what she's done, honestly. If she was having a psychosis episode, it could just happen like the case of Cash Gurnan, rest in peace. The poor little boy was killed and his body was thrown out on the street. The 18-year-old boy who was allegedly going to get the capital murder, did not get that capital murder. Is being put because he doesn't have the he's not mentally fit to be put on trial. And he was having he had bipolar and psychosis. Darlene Brown, who was in the Cash Gurnan case, rest in peace. So schizophrenia is a severe illness. Bipolar, if the person is not on the medications, It was just a ticking bomb. So I really hope she gets the help she deserves. And there was another thing, her boyfriend mentioned clearly that he was on opiates for a couple of years and he was doing other addictions. So I wonder if that just remained in the past and that they haven't done it again, because this is another case that doesn't make sense. I just hope that she gets the psychiatrist help, because that she looked completely stressed, distressed, confused, very confused. That's the reason I believe some laws needs to be changed. I believe if somebody is suffering of severe mental illness, especially like schizophrenia, and they could be having psychosis or they could be hallucinating and delusions and all those things, disorganized speech, disorganized behavior, I believe such things should be taken in consideration. I believe maybe they should change the law to get an attorney no matter what, and to get a couple of witnesses, so that at least, because this person is clearly not in a right mind. She said towards the end, what did I say? I can't remember. And because you remember the start, she said, I want to be charged for all the attempted murders and all. But then later on, it's like she snapped back to herself. So it could be, that is definitely possible. I've seen that happening many times. So people can get into those kind of states. But hopefully they'll find what is right. Guys, take it easy. Please make sure you'll drink plenty of water. Do not be dehydrated. Take good self-care. Please make yourself a note learning thought journal. It does help if you're suffering of anxiety or depression. Remember that if you think positive, it will lead to, if your cognitive thoughts and all that is in the right place and you're thinking positive, remember that leads to better feelings and emotions, and that leads to better behavior. So always try and listen to your body and listen to your mind, especially. Like they say, listen to your heart. I would say listen to your brain too. If you feel like you're getting anxious, take a break if you can afford to. And if you can't take a break, then make sure to avoid doing things that make you anxious. Like, just say if you have to stress to go to work and you always see that you live maybe 15 minutes from work, but you're always the one who's late at work and it's affecting your work and your boss has warned you, example, I would have advised maybe go an hour early. It's better to be late. It's better to be early than late. And that will spare you a lot of time not to be anxious, because it's not a good feeling at all. And we should learn how to control ourselves and learn to listen to our thoughts. If you have a problem, try and identify the problem, find out where the problem is coming from. And by having a learning journal, writing your everyday thoughts and feelings, it helps you to gather your thoughts. It helps you to basically, to gather your thoughts to balance your thoughts. And in a way, it will help you to have a better structure that will bring you into anxiety and depression. If you have depressions and you're suffering of depression, guys, the weather's changing. Take a walk outside. I know it's easy to say, hard to do for people who are suffering of depression, but take it step by step. Maybe just walk for 5-10 minutes. And maybe the day after work for 15 minutes. And if that goes, then 20 minutes. Because then you'll be getting a physical exercise, and at the same time you'll be getting a mental exercise. It is important to listen to your body and listen to your mind. But it's really all the clients that I've had have always told me that I'm really glad that y'all advise us to make a learning thought journal. And like when with clients, when you give them skills and things that we kind of give them homework to take with them and to write on a learning journal, and then we check the learning journal with them the next time they come. That's part of their homework. So then you see that they write, like, maybe example, they write, oh, Monday I was having a beautiful day, I wasn't depressed, my friend called me, we went outside, we had a nice meal, and then we met some other group of people and we enjoyed. Then maybe they write on their journal, oh, Tuesday was a messed up day, everyone started with me, my brother, my mother, oh, I hate the world, I hate this one, I hate that one, my boss is this, that, you get me? And Tuesday could be a terrible day. And then you ask them, so what did you do when you had this feeling? Then the client may say, oh, I came home, I immediately shut down my curtains, I immediately made my room dark, I put off my mobile on flight mode, I don't want to be disturbed. Then you'd be like, what happened on Wednesday? Wednesday, Thursday, Friday has been lousy for me. What happened on Saturday? And they may turn around and tell you, oh, Saturday was lovely. Friends came over, had guests over, and I enjoyed and all. So they themselves see their own thoughts, what they've written there. So it helps them to identify their problems. Then you will notice where your anxiety is coming from, or under what circumstances the anxiety triggers up. If it's PTSD, you feel the same, which is although a bit more more deeper with PTSD, is just to avoid places that brings you the same trauma. And we work a lot with avoidant behavior personalities. Like example, you can say somebody's been driving all of their life, but all of a sudden they've started being avoidant to driving. They keep on isolating themselves, procrastinating themselves. Many different things happens to in avoidant personality. But then you have the normal one, which is the compulsive compulsive behavior that is working too much, maybe overeating, over drinking too much, like addictive behaviors and all that. So the best way to work on them is like with the avoidant one, try and socialize. I know it could be difficult for people, but try and take a step, like I was saying, like maybe walk 5 minutes today. Like try and explain to yourself, like with your thoughts, that I'm going to do this, I can manage to do this. Because if I do this, then I would be less anxious. Like boost yourself. It's important to give yourself good confidence too. It helps with the self-esteem. Yeah, so I would say basically it's cognitive behavior therapy. Good thoughts, positive thoughts leads to positive feelings, and positive feelings leads to positive behavior. So we try to avoid the negative thoughts. That's the word. And we have a module called GAD, GAD for that. But then in mental health branch, we always use the DSM-5. That's how we work with with our clients basically, and that is mostly to see like like under under the scale, like how high is the anxiety, example, how low is the depression, or how high is it. It all just depends on, like, you check it week to week every time they come to therapy, and then it's not like it's a magic thing that will work overnight. But then like with a couple of months therapies, usually the clients see the positive sides to therapy. And cognitive behavior therapy is quite popular these days. There are many clients that are satisfied with that. One of the reasons I believe it's a here and now therapy. It is a short therapy. It usually doesn't last for more than 10 to 12 weeks, if not recommended longer by psychiatrists. It is usually helpful for people with different problems. If they have a personality problem, they're like antisocial personality behavior is one example. SOX offenders, people who could be suffering of serious depression and bipolar, schizophrenia, people who have eating disorder, people who have drinking disorder, people who are suicidal, different kind of people. But cognitive behavior therapy was made by Aaron. The founder of cognitive behavior therapy is Aaron Beck. Aaron Beck, I believe he died when he was a bit over 100 years of age. He started his work, I believe, in the University of Pennsylvania. And CBT was founded in the 1970s. It came from REBT. So CBT is basically here and now therapy. So short-term therapy. So people find it quite effective. It is usually even for people with OCD, people who have phobias, and people who have a negative cognitive issue or situation. So it's always good to think positive. Then you will have lesser anxiety, lesser depression, and lesser mental illness. It's always good to write down in a learning journal. I advise everyone, my family, my friends, people that I talk to, and when they ask me, like, what will you do as a therapist? And I would say, just don't stress your thoughts, don't overthink. Write it down. Write it in a piece of paper. Keep it safe. And then check the next time you write about the same situation again, maybe with all the therapy, and now that you've learned how to identify your thoughts, maybe it'll make it easier for you next time. And they all come back with positive results saying that it does help. So guys, anxiety and depression is something that is real. Some of us take it to be minor, but it's absolutely not minor, because it can lead into serious mental illness. And it's a known fact, if people suffer too much of mental illness like anxiety and all, it releases out hormones, the stress hormones, that can even start affecting other organs in your body, or hair growth, example, many other things. Anxiety and depression are actually serious. So guys, please like, share, and subscribe, and have a lovely week ahead. Thank you. Bye.